name is Ivania. I work at Afea as a support coordinator, and I have a pleasure to interview Mark and Amanda today at Care Squared.
Hi, I'm Dr. Amanda Mazzoni. I am the National Manager for Care Squared Kids.
And I'm Mark Traves. I'm Head of Partnerships for Care Group.
Thank you very much, Amanda and Mark. So the first question is for Amanda. Can you share your journey to becoming an allied health professional?
In my early 20s in a degree in psychology, and I didn't know where it was going to take me. I just thought, oh, I'm really interested in this. And I then went on to do a PhD because I still wasn't really sure what I wanted to do, but I knew I was really interested in working with children, and I was offered an opportunity that I really couldn't say no to. But then when I finished, I was like, I think I'd like to be registered. I think I'd like to actually work with people, because a PhD will take you in an academic discovery pathway, I suppose, and definitely keep you at university. But I wanted to be on the ground with people. Now I am the National Manager for Care Squared Kids, and I absolutely love it. But I also feel very proud that I get to train clinicians to have the same insight as me. So to say, when you work here, you are accountable to these families, you're accountable to these children's quality of life. Whatever their journey was, you are part of it now, and you're an advocate for them, and you need to make sure that you're accountable to them. And I know every day that I hold that weight, and it's my job to make sure that all of my clinicians are upholding that for our families. I feel that our role is to skill build. Now, skill building sounds so basic, right? But it can be anything. And it can be the things that you and I take for granted, like social skills. It can be making a meal. It could be going on a bus and catching the bus to and from, a community event that you and I, like I said, just take for granted. We can do those things. But without those skill builders, without those little things that allied health step in to do and break down the steps in however many steps they need to, because it depends on the person's capacity, right? It depends on what they can do at that time and where they're at. You have to meet them at that level that they're at, and you have to work with them to bring them to the skill that they can achieve and do it achievably as well. But that means, for them, those little things that we take for granted, that's the difference between leaving the house. That's the difference between them having independence in the community. It's the difference between them making a friend, things that we can go out and do every day. And if you actually think about it, the gravity of that is huge. So for me, the allied health industry is so significant in improving life and quality of life. And it comes back to skill building.
Can you describe your working relationship with Afea, Mark?
I met Decky at my very first Ready, Set, Connect, and just really from that first interaction saw just how engaged the Afea team are and how they really do focus on supporting their participants. And what I love working with Afea around is that your entire team and all of the SEALs, everyone is really open to supporting the participant, coming into people's homes to deliver services. So we're entering in their environment, and we want to make sure that's as streamlined as possible, so that it's my home and that we become a part of that home for them. It's also great for us to be able to support the support workers in the home together in the same way. From a support coordination standpoint as well, working with Afea is great because you're really responsive.
Just around the relationship with support coordinators and allied health, people might not understand the actual significance of that relationship, but I can only speak from my personal experience, and also as a national manager and understanding my clinician's relationship with the support coordinator, but it is an extremely important relationship. So in a lot of instances, probably more often than not, the support coordinator can be the only person advocating for that person. Sometimes they don't have a nominee. Sometimes there isn't there's a guardian, but we all know that guardians, they're not really in the picture as much. Some are, but majority of the time it's not. And the support coordinator is filling a big pair of shoes. And so if the allied health and the support coordinator are working very closely together, which I have in the past with pretty much all of my support coordinators, I know that you can get things done. I know Ivania sitting there going, yes, you're right. Like that's a lot of weight for me to hold, right? That I could be the only person helping these participants. But if you've got someone behind you and you're working together, that you're sharing the weight and you're advocating together, which means there's more people in that participant support network.
Also feeling part of my role is just seeing participants being able to have make positive changes. Sometimes there goes ups and downs, and I'm part of the journey. As Amanda said, sometimes the participant doesn't have any family. And then I get a feeling that they are actually are moving on and living a better life.
I love that. As a national manager, I get to see what the need is in the community. And for me, it's that what can I do? How can I help? Where can we jump in and fix the problem?
Be part of that is so wonderful, and seeing the results for the participants. You know, we've had participants who've gone through our Connections and Relationships program, and they've actually made friendships. Some of them have actually forged personal relationships. So we've had people who, at the end of a Connection Relationships program, have gone on dates together and they've become a couple. So to be able to see people leaping ahead like that, it's just so wonderful. And, you know, you can't put a price on that for people. So it does come back to that enjoyment of life again. So I love coming to work every day and seeing the difference that we make to people's lives.